Which of the following terms is used for an individual who is or has delivered or is about to deliver their first child? A. Nulliparous. B. Primiparous. C. Grand multiparous. D. Multiparous. The answer is B. Primiparous. Nulliparous, never delivered a child or carried a pregnancy past 20 weeks. Primiparous, has given birth once or is about to give birth for the first time. Multiparous, has given birth twice. Grand multiparous, has given birth 3 or more times. Which of the following hormones stimulates uterine contractions? A. Estrogen. B. Oxytocin. C. Progesterone. D. Prolactin. The answer is B. Oxytocin. Contractions in labor are stimulated by oxytocin, a non-peptide hormone produced in the hypothalamus and stored in the posterior pituitary. Oxytocin also triggers postpartum contractions in order to compress the lax uterine wall and reduce postpartum bleeding. Prolactin is a hormone essential to breast milk production, while estrogen and progesterone have a multitude of roles in both fetal and placental development. Which of the following is not a role of oxytocin? A. It triggers uterine contractions during labor. B. It stimulates contentment and pleasure in social relationships. C. It is involved in wound healing. D. Increases appetite. The answer is D. Increases appetite. Oxytocin, a non-peptide hormone produced in the hypothalamus, has a variety of physiological roles. It increases trust, generosity, and other markers of social cohesion. In intimate relationships, it increases feelings of affection, love, sexual arousal, and contentment. It is an important hormone in labor, as it triggers contractions both during labor and postpartum in order to reduce bleeding and uterine size after delivery. It also acts as an immune modulator in wound healing. It does not, however, increase appetite. Studies have shown it to have the opposite effect, acting as an appetite suppressant in human and animal models. Which of the following terms describes the thinning and shortening of the cervix that occurs during labor? A. Transition. B. Bloody show. C. Dilation. D. Effacement. The answer is D. Effacement. During the later stages of labor, the cervix, normally a 4 cm long muscular sphincter, releases its mucus plug, then thins and shortens. The release of the mucus plug is termed the bloody show, and the thinning and shortening of the cervix is called effacement. Cervical effacement is almost always accompanied by cervical dilation, or a widening of the os in order to allow passage of the fetus. This all happens in the transition phase of labor. At what point during labor is the cervix considered to be fully dilated? A. 11 cm. B. 8 cm. C. 9 cm. D. 10 cm. The answer is D. 10 centimeters. The cervix is considered to be fully dilated at 10 centimeters. This suggests the transition phase of active labor, in which the individual is instructed to bear down, push, in order to facilitate delivery. How does blood plasma volume change over the course of a normal pregnancy? A. Increases by 50%. B. Increases by 25%. C. Decreases by 10%. D. Decreases by 25%. The answer is A. Increases by 50%. During a normal pregnancy, the volume of blood plasma increases by 50%. The erythrocyte count also increases, by as much as 30%. This may cause the hematocrit to appear lower than normal, due to dilution by the relatively larger increase in plasma. What hormone is responsible for triggering nausea and vomiting of pregnancy, morning sickness? A. Dehydroepiandrosterone, DHEA. B. Corticotropin-releasing hormone, CRH. C. Aldosterone. D. Human chorionic gonadotropin, HCG. The answer is D. Human chorionic gonadotropin, HCG. While research is still being conducted to determine the cause of nausea and vomiting of pregnancy, it generally correlates with the surge in human chorionic gonadotropin, HCG, that occurs in the first trimester. Estrogen may be another contributing hormone. Aldosterone, DHEA, and corticotropin-releasing hormone, CRH, have no apparent involvement. Most at-home or in-office pregnancy tests detect what hormone? A. Estrogen. B. Progesterone. C. Prolactin. D. Human chorionic gonadotropin, HCG. The answer is D. Human chorionic gonadotropin, HCG. Most pregnancy tests detect HCG, a hormone produced by the embryo that is detectable shortly after implantation, 10 to 14 days after fertilization. The function of hormone is to mimic the effects of luteinizing hormone, ultimately preserving the corpus luteum, which secretes progesterone. The progesterone maintains and vascularizes the uterus, making it a more favorable environment for the implanted embryo. A nurse is educating a group of young females about the physiology of fetal development. The nurse explains the stages of how a young fetus over time will develop and what special events take place over time. Which of the following events is correctly paired in regards to expected fetal development? A. 8 weeks, sex of the child is recognizable. B. 10 weeks, lanigo grows. C. 12 weeks, quickening occurs. D. 15 weeks, the eyes are open. E. 20 weeks, heartbeat first heard with a stethoscope. The answer is E. 20 weeks, heartbeat first heard with a stethoscope. The time frame correctly matched is at 20 weeks. The heartbeat is heard with a stethoscope, although it may be heard with ultrasound as early as 10 to 12 weeks. Quickening usually occurs around 20 weeks as well. The eyes open later between 24 to 27 weeks, lanigo first appears between 13 to 16 weeks, and the sex is recognizable around 12 weeks. At what embryonic age does the neural tube form? A. 5th week. B. 6th week. C. 3rd week. D. 4th week. The answer is D. 4th week. The neural tube forms from the neural plate during the 4th week of embryonic development, which is often before the mother knows of the pregnancy. Which of the following is a term for a substance that has been known to cause birth defects? A. Teratogen. B. Carcinogen. C. Mutagen. D. Pyrogens. The answer is A. Teratogen. A teratogen is a substance that has been known to cause birth defects. Some teratogens include alcohol, tobacco, phenytoin, rubella virus, and tetracycline. Carcinogens are a subclass of mutagens which have been known to cause cancer-inducing mutations. Mutagens cause mutations in cellular DNA expression, which may or may not lead to cancer or any other pathological condition, and pyrogens are substances that cause fever. The process by which an embryo develops from a single-celled zygote into a complex organism with many cell and tissue types is called A. Translation. B. Evolution. C. Differentiation. D. Transcription. The answer is C. Differentiation. The term for the development of specialized cell types is differentiation. This is a process by which pluripotent embryonic stem cells, all of which have the same genome, are methylated in various ways to turn off certain genes and leave other genes exposed for transcription. This allows cells to develop the specific features that they will require to perform their function as heart cells, neurons, etc. At what point in a pregnancy is miscarriage most likely to occur? A. The third trimester. B. The second trimester. C. Miscarriage is equally likely the first or second trimester. D. The first trimester. The answer is D. The first trimester. Over 85% of miscarriages occur in the first trimester. Less than 10% of miscarriages occur in the second trimester, and miscarriage in the third trimester is very rare and generally considered to be stillbirth or preterm delivery that result in loss of the baby due to complications, most often respiratory or digestive underdevelopment. Which of the following hormones, if insufficient, would be the most likely to cause early first trimester miscarriage of a healthy embryo? A. Aldosterone. B. Estrogen. C. Progesterone. D. Cortisol. The answer is C. Progesterone. While all of the hormones listed are important for development of a healthy embryo, the most important hormone for preventing early first trimester miscarriage is progesterone. This hormone is generally secreted by the corpus luteum in sufficient quantities to prevent the shedding of the endometrial lining after implantation. When progesterone is insufficient, the endometrium can be shed as in a regular menstrual period, resulting in loss of the pregnancy. In most cases this type of miscarriage can be easily prevented by supplementation with vaginal progesterone suppositories. The endoderm forms which of the following tissue types? A. Epithelial linings, several endocrine organs, the bladder, and the respiratory tract. B. The liver and pancreas, the adrenal glands, and the kidneys. C. The endoderm forms all of these tissue types. D. The respiratory tract, the pancreas, and the nervous system. The answer is A. Epithelial linings, several endocrine organs, the bladder, and the respiratory tract. The endoderm is the deepest, most proximal, germ layer of a developing embryo. It forms several endocrine glands including the pancreas, the thyroid, and the thymus. The adrenal glands and kidneys, however, are derived from the mesoderm. It also forms the bladder and ureters, the respiratory tract, and the epithelial linings of the GI tract and auditory system. The nervous system is derived from the ectoderm. Defects in the formation of what embryonic structure can result in spina bifida, anencephaly, or cleft lip or palate? A. The bulbus cordis. B. The neural tube. C. The cloaca. D. The archenteron. The answer is B. The neural tube. Defects in the closure of the neural tube, a rudimentary precursor to the nervous system, can result in several serious conditions. Of these, the most common are spina bifida and anencephaly. Cleft lip and cleft palate are also common defects of neural tube development. Defects in the cloaca and arch enteron would affect gastrointestinal development, while the bulbus cordis is a part of the developing cardiovascular system. At what gestational age can the fetal heartbeat be detected? A. Week 10. B. Week 8. C. Week 5. D. Week 7. The answer is C. Week 5. The fetal heartbeat is generally first detected at 5 weeks. This can be monitored by ultrasound and auscultated. Fetal heartbeat is an important aspect of assuring fetal health through pregnancy. The formation of the yolk sac happens at what week of embryonic development? A. Week 3. B. Week 4. C. Week 2. D. Week 1. The answer is B. Week 4. The yolk sac is a membranous sac that provides nutrients to a developing embryo. It is generally visible via ultrasound by the 4th week of gestation. Which of the following is not one of the 3 basic germ layers formed during embryonic development? A. Endoderm. B. Ectoderm. C. Mesoderm. D. Trophoderm. The answer is D. Trophoderm. The 3 germ layers formed during embryonic development are the endoderm, the mesoderm, and the ectoderm. The trophoderm is not a germ layer, it is the membrane that forms the wall of the blastocyst in early embryonic development. Which of the following tissue types is derived from the ectoderm? A. Teeth. B. Skin, hair, and nails. C. Nervous tissue. D. All of these are correct. The answer is D. All of these are correct. The ectoderm is the outermost germ layer of a developing fetus. It forms the nervous system, teeth, skin, hair, nails, sweat glands, mouth, and anus. Which of the following tissue types is not derived from the mesoderm? A. Red blood cells. B. Thyroid. C. Muscle cells. D. Pericardium. The answer is B. Thyroid. The mesoderm forms skeletal muscle, cardiac muscle, smooth muscle, connective tissue, the pericardium, in addition to several other membranous sacs such as the peritoneum, and red blood cells. It also gives rise to cartilage and bone, the dura mater, the kidneys, and the adrenal glands. The thyroid is derived from the endoderm. Which of the following medications is known to have teratogenic effects? A. Warfarin. B. ACE inhibitors. C. Isotretinoin. D. All of these. The answer is D. All of these. Multiple forms and classes of medication have been shown to cause birth defects. These include ACE inhibitors, antiepileptics such as phenytoin and valproic acid, isotretinoin and other forms of high-dose vitamin A, and blood thinners such as warfarin, among others. Fertilization generally occurs in what location? A. The distal two-thirds of the fallopian tube. B. In the fundus of the uterus. C. In the femur. D. In the body of the uterus. The answer is A. The distal two-thirds of the fallopian tube. Fertilization happens in the fallopian tube, most frequently in the distal two-thirds of the tube. Dash is the fetal structure that allows approximately 20 to 30% of blood to bypass the liver and flow from the umbilical vein to the vena cava. A. The ductus venosus. B. The foramen ovale. C. The umbilical vein. D. The ductus arteriosus. The answer is A. The ductus venosus. The ductus venosus is a small shunt that allows a portion of fetal blood to bypass the liver and flow from the umbilical vein to the vena cava. This allows more oxygenated blood to be available for the developing fetal brain. The ductus arteriosus and foramen ovale are both fetal cardiac shunts. The placenta secretes all of the following hormones except A. Aldosterone. B. Human chorionic gonadotropin, HCG. C. Human placenta lactogen, HPL. D. Estrogen. The answer is A. Aldosterone. The human placenta secretes estrogen, progesterone, human chorionic gonadotropin, HCG, and human placenta lactogen, HPL. Aldosterone is produced by the adrenal gland.